We at the Duquesne University Health Service advocate the provision of competent, confidential, and compassionate health care to all full-time undergraduate and graduate students for the education of the mind, heart, and spirit. In order to better understand Duquesne University's health service, we conducted an interview with Nancy Kennedy Generalovich, a student coordinator and staff nurse at the health service.
My first question, Nancy, is what is offered at the Student Health Services Center?
A full-service health service for all full-time students at the university, whether you're graduate or undergraduate. And we have available to the students Monday through Friday, 7:30 to 6 o'clock we're open. Appointments start around 8 o'clock, although if somebody walked in at 7:30, certainly we would not be turning them away. But usually between 7:30 and 8, we're doing the lab collections and things like that, and reviewing the schedule for the day and getting the room set up and that sort of thing. So pretty much from 8 o'clock to about 5:30 we'll schedule appointments. We run kind of like an urgent care center, like a MedExpress or something like that, but more like a doctor's office. And we have a physician on staff Monday through Friday, and she is here. She's a physician with UPMC adolescent medicine program over at Children's Hospital. And she's here about 4 to 6 hours a day. And we have 2 nurse practitioners, a physician assistant, and they are all full-time. And then we have a 3rd nurse practitioner that's part-time, who actually is a professor in the School of Nursing. And she's a nurse practitioner that specializes in gynecology and that sort of thing. And so she volunteers her time for the university. Our services are services such as if you need a physical exam because you're going to study abroad or something. The international students come and get driver's license physicals. We do routine testing that's required for your schools, such as the PPD skin test for tuberculosis that you're required to get as a student nurse. And we do those here at Health Service, and all of the pre-clinical requirements. So those are sort of the services that we offer. Sick services are just what they are. You're sick or you're injured and you can walk in or call. Typically speaking, we have more students that need things than we have hours in the day to cover. So that's why the appointment part is important, because there's so many kids walking in that it's hard to get everybody in, so it makes it a little more organized. So we ask that people call in and schedule appointments or stop in and make appointments, and everybody is seen either, and it's triaged. We have a nurse in the front who talks to the kids when they come to the windows or answers the phone and does a triage and assessment of what it is that they are calling for, stopping in for, and assigns them an appointment accordingly based on their acuity, whether they could be served by a nurse who can assess them, do a throat culture, and check them the next day, bring them back in if necessary to see a practitioner, or whether it's something that's urgent and needs immediately seen by a nurse practitioner or the doctor. So they're scheduled in that manner. We have an immunization clinic that runs once a month. So if you're missing a requirement, or you want a flu shot or something of that nature, we schedule appointments on the 1 day a month immunization clinic. The PPDs, some of those things that we do, we can do them at any time, but it works better with a clinic that's all day long, where we're just doing nothing but immunizations. Let's see, we do lab work here on site, some of it, but then we have rapid streps as of about a month from now. Other than that, we do routine throat cultures and send them over to Mercy. So if you need blood drawn because you're in here and we suspect something, for example, like mono, and all the blood work, the mono spots and the EBV titers and things like that, we're able to draw them here, and then we send them out using your insurance to Mercy to be evaluated, and they come back electronically. We have electronic medical records, so every student that comes here has their own electronic chart, and when you come as a student, you're required to fill out a health history and submit immunizations. That all gets scanned into the computer system and is in your electronic medical file. And when you come for an appointment, your record is open, the triage note is put in, you're scheduled through that system, and the practitioner that's seeing you can pull up your chart, see your health history, your immunizations, whatever your histories or your chief complaint is or whatever, and then go from there. Electronically submitting the lab orders, the medication orders. We use the pharmacy on the hill that is operated through Duquesne, although you're free to use a prescription and go to a local pharmacy if you choose to do that. But the electronic system, we have an interface with that pharmacy, and it submits through the electronic medical record to the pharmacy. It's filled, the pharmacy delivers it on campus to the students. So they use your student insurance to pay for the prescription. We submit the insurance when we submit the prescription or the lab work. Fees for service here, there is none for the actual service of seeing the nurse or seeing the physician. The things that we do in-house are free. The things that we do out-of-house, we use insurance for. Or if you have a product, say we give you a starter pack of an antibiotic when you come in, you would be charged a nominal fee for the starter pack, and then the prescription would get filled through the pharmacy, and they'd bill you for the rest of it through the pharmacy. So free to walk in the door and say, I need you to look in my ears or look at my throat or whatever.